In the conversation about the repeal and or replacement of Obamacare, there's this premise that Obamacare is imploding. The Trump administration likes to say Obamacare is in a death spiral. I've been super clear with you for years that Obamacare has major problems, namely, it's a gift to the immoral status quo of the for-profit insurance companies and industry. You don't really need to go much further than that. There's a major, there's a really significant list of criticisms of Obamacare. But according to the Trump administration's own data, it's just not true that Obamacare is imploding and urgently needs to be repealed. It needs to be fixed as a symptom of the broader problem that we have in our country around healthcare. But a death spiral is the complete wrong way to be approaching this. We now have data from the Centers for Medicare and Medicaid Services. Now, that's part of the Department of Health and Human Services. That is now run by the Trump administration. We have data from Obamacare from 2016. And it turns out that those insurance marketplaces established by the Affordable Care Act were actually pretty stable. The right likes to sell you the horror story of some single mom with 22 kids who works at Burger King and has 12 pre-existing conditions. And she's the only person going to the exchange and she's driving up the cost of everybody's health insurance. But the truth is that the mix of healthy and sick people who signed up for insurance through the marketplace in 2016 was pretty similar to the mix in 2015. Premiums have been trickling up in total, in sort of aggregate average. But recall that premiums have been increasing in cost for a very, very long time, both inside and outside of Obamacare exchanges. That's just what's going on with our system. Doesn't really tell you anything about whether Obamacare is imploding. So Obamacare is no panacea. And every time I have to defend Obamacare, I need to make clear that I think Obamacare is only even possible in a horrible system where we have employer-connected for-profit health insurance. It's a train wreck, right? And there are specific problems with Obamacare. Some people make too much to get subsidies or marketplace plans, but they still can't afford insurance. Other people have opted not to enroll anywhere because it's just too expensive and they're paying a fine and still having to pay for healthcare out of pocket. But this is according to Trump's own Health and Human Services data, which rejects this idea that any day now we're getting to this cliff, which will explode a death spiral of the Affordable Care Act. And this actually is part of why Republicans might be moving in the direction of saying, hey, if we can't pass a replacement, Pat, let's just repeal the Affordable Care Act. And if we can't repeal the Affordable Care Act, let's at least starve it of funding, because then we'll have a death spiral, which we will cause. This is basically, if it won't fail, they will kill it and then say, hey, we had a solution all along, which Democrats obstructed, which obviously wouldn't be true to begin with.
And now you have Republicans like Senator John McCain saying that if the American Health Care Act doesn't pass by the recess in August, then it's probably dead in the water.
Yeah.
Then they may take the approach of, say, Ted Cruz, who says, let's just repeal the Affordable Care Act and see what we can do in the next couple of years. I wouldn't be surprised if there was a third approach and Trump just says, well, I fixed it according to my own Health and Human Services numbers. Great for me, right?
Can you imagine? Nothing happens. And then Trump goes, hey, listen, after all of those lies from Health and Human Services under Obama, it turns out that I'm getting pretty good numbers from Health and Human Services now about Obamacare. And clearly it's because I'm now the president. So, hey, I did it. I made it work beautifully for everybody all of a sudden.
I think I'd take that deal.
Yeah, I mean, at this point, it's probably the best option for Trump. And I've also been reading a couple reports that say, what's the last day? It's the last, like the 27th of July or something is the last day of the session. And then House and Senate basically they get all of August off, I believe, don't they?
Well, it used to be so hot in Washington, D.C. that they'd give you all of August off. I mean, now, of course, we have the advent of air conditioning, but forget about that. They need the whole month.
How funny is it that the American right criticizes France for being sissies and for having this short work week and blah, blah, blah. And there's really nothing more French than getting out of town during all of August. And that's exactly what our Republican and Democratic elected officials do. Here's the most important thing to remember. Republicans have to take an outrageously extreme position right now on the Affordable Care Act because the Affordable Care Act is already right-wing, period. I've said this, it must be hundreds of times at this point. Anything you do to move to the right from the Affordable Care Act is going to be extremely right wing by its very definition. And now Republicans have sort of shot themselves in the foot. But rest assured, they'll figure out a way to blame Democrats, Hillary, Obama, or I don't know, liberal media for what is shaping up to be a major failure on that campaign promise.